Welcome to our strategic planning update for 2024. It's hard to believe it's already been 3 years, but this is the third year of our strategic plan. We are excited about what has been accomplished and looking forward to more that we plan to do here in our third year. In addition to executing that third year, we'll also be starting to lay the groundwork for the refresh of our strategic plan that will take place in 2025. Special thanks to all of you, those of you that have joined work groups and helped us put the puzzle pieces together to make some of these goals and initiatives come alive and realized. I also want to thank the steering committee. They've really provided significant leadership over these last 2 years, and I know will continue. Greg Zars, Nicole Liebau, Alice Schaller, Christy Shannon, and Christy Wilchin really have stepped up and provided great leadership in making sure that we hold ourselves accountable to this strategic plan. So I hope you enjoy this update, and thank you for all that you do. As we get started, I think it's appropriate that we review quickly the pillars that really stand alongside our strategic plan. Starts with people and partners. There is no question it takes people. It takes people like yourselves delivering every day. It takes a strong board that can provide guidance. We need volunteers because we have a far reach in our strategic plan, and there's always critical partners that really help us. They collaborate with us and help us extend our reach. Secondly, it's programs. It's what we do, it's what we provide, it's what we contract for, it's who we collaborate with to make sure are available in our communities. And there's no question that as we look at those, we try to make sure that we are always delivering to those in most need. Thirdly, technology. Who doesn't love technology, but only when it works? In our case, we're really looking at leveraging technology and trying to figure out, can we use it to expand our reach, to go deeper with services and programming that we offer the people that we serve. And so we live with it and we try to leverage that to our best ability. And then lastly, it's measuring impact. It's got to be more than just a feel good. We have to be able to look at hard data and reconcile that with all of the others, the people, partners, the program, and the technology, to really look at are we delivering on that mission that we talk about every day, and are we doing it to our best and to our fullest. If we step back and think about the impact that we want our strategic plan to have, really talking about older persons will live their best lives. Who doesn't want that? That works for us, that supports us, that really says it all. And it's a vision, I think, that drives our organization. Certainly, we have adults with disabilities. We want to make sure that they know where to turn when needs arise. The people that are charged with caregiver responsibilities, we want to be their backbone. We want to be there to support them, to educate them, to guide them, and assist them in whatever way we can. Certainly, all of you, our board, the great volunteers that we have, and our advisory council. If we're not feeling engaged in what we're doing, I'm quite sure we will not deliver on the impact that we talk about in our strategic plan. And certainly we can't do it alone. We're always going to rely upon community partners who we can collaborate with that really allows us to extend beyond what we could normally do alone. And that's really where we can create the greatest impact.
We will now be focusing on our completed initiatives. For our pillar of program, we have developed eligibility screening to include priority scoring for our home delivered meals. This has helped us to create our waiting list into more of a waiting room, having our highest priority consumers on that list and ensuring we are serving those consumers most in need of our services. We also assess the delivery logistic to establish a policy and procedure for our home delivered meals. This had been used through many different aspects as we were looking at the nutrition programming and also at how we could best serve the most individuals through our home delivered meals program. And finally, we developed the eligibility screening to include priority scoring for our home and community-based services, our elder service dollars. This again helped us to really evaluate that waiting list and to ensure that we are serving those individuals who are most in need of our services. The second pillar that we're going to focus on is people and partners. The first initiative on here is train all staff on NEI 3 programs, services, and eligibility criteria. This would involve creating the training video on all programs in the smaller segments featuring specific programs. It also helped create the services guide for educational purposes and the spotlight in the employee newsletter monthly on a program. We also completed utilizing the engagement committee to implement, analyze, and enhance engagement surveys, the process, and the results. After completing engagement surveys on the board, the volunteers, and all staff, we reviewed the process and all of those results and action plans. We looked at where we could enhance those processes and then went ahead and we have also launched the second staff engagement survey and are getting into the action plan for that. We also utilized the DEI committee to continue implementation and development of DEI policy and DEI work environment. There are many committees within the DEI committee that are working very hard at having us have a DEI policy, having a good process for all of that, and bringing in some great DEI trainings for all of us. This would include the trainings we had from Gina and also looking at some of the trainings we are being offered, such as the SAGE training. And the last one completed was establish a governance assessment process. This was all within our board of directors utilizing the governance assessment process. The next pillar we will look at is technology. The initiative we have completed through our technology pillar is implementing the employee newsletter. We all look forward to the employee newsletter each month, where we can see all the different programs, the program spotlight, and all of the great activities and work that everyone is doing throughout our agency, and all of the pertinent information regarding upcoming events and different activities and those success stories that are in that newsletter. The final pillar that we will be discussing, the completed initiatives is measuring impact. The first initiative completed is utilize partnerships with colleges to design surveys for impact, outcomes, and program evaluations. We utilize a partnership with Wartburg College we have had for many years, where they have helped design yearly surveys that have been sent out to our consumers. The committee reviewed all of those past surveys to find the questions that we found most beneficial for our outcomes and evaluation of the programs, and then looked at the wording of those surveys and the responses to see how we can best tailor those for consumer response. So they, one, understand the question and how it applies to them, and two, it is one of those questions that is very easy for them to answer, where they feel that they are able to give their information without us identifying them to use that for our program evaluation. This year we launched these surveys on home delivered meals. We also launched them on information assistance, options counseling, caregiver, and case management. We will be looking at this fall, again, utilizing the partnership and hopefully being able to add to our list of programs that we will be evaluating through these ongoing surveys. The other initiative was utilize the engagement committee to identify engagement survey for staff, volunteers, and board. We had a very great success rate with the first engagement survey, with many of our employees responding to that survey, with an even higher percentage response the following year. We had completed our first year's action plan, did those reviews as we had previously talked about, and now are into our second survey for our employees. We also had a great response by our board for that initial one, and a decent response for our volunteers, which we will be looking at revising the volunteer one now with our revised volunteer programming. Next, our initiative leaders will discuss their ongoing 2024 initiatives and where we are in the progress of those. If any of these initiatives are near and dear to your heart, please reach out to the leader of the group or any of the team members and bring forward your ideas or ask to be a member of that committee.
Under the pillar of people and partners, our first strategic planning goal is to develop an internal succession plan. The importance of developing a succession plan is to ensure the agency's commitment to ensuring continuity, development, and growth. This work is in its beginning stages, but we have started to identify what we want to accomplish. We want to identify key positions, roles, and functions within the agency. With specific roles, we are gathering skill sets, eligibility, and competencies required for each position. Job descriptions are being updated. And equally important is identifying unwritten processes, as we need to be fully aware of important tasks that are followed up on that others may not be aware of. The goal is to be transparent about the duties and responsibilities we all have. All employees will have the opportunity to have conversations with supervisors to identify interest in growth and potential future leadership roles if that is your desire. Or if you are content in your current position, what goals and responsibilities do you want to assume to grow within your current role? We expect these conversations to be open and ongoing, and not only during performance reviews. It is important to note with this goal that development plans belong to each employee, whether you intend to grow in your current position by improving and getting better at what you are currently doing, or take on opportunities to move into a new role at the agency. We also want to focus on leadership development. Our plan is to create structured training and development opportunities. This will include a mentorship program and encouraging ongoing education and skill development. It will also involve opportunities for cross-training. Lastly, we need to ensure communication continues as roles and functions evolve and adapt and conversations continue to pursue individual goal planning. Contingency planning is also an important piece of succession planning, as it involves having a plan for unexpected leaves, departures, or emergencies in key roles. Again, it's important to note that the development plan belongs to the employee to help advance and/or to grow in your career, and ultimately strive to be proactive in pursuing goals that in turn supports a successful agency. As stated, we are in the initial stages of this goal for this strategic plan, and we welcome additional members to join the committee for this important work.
With the reorganization of the nutrition program, we were able to identify an individual who would now be primarily overseeing the volunteer program. This means that we have a little more time and a little more capacity to really look at what our volunteer program should be and could be. So this is definitely in progress, and we hope between now and the end of the calendar year we can see some real progress toward creating a new volunteer program that not only serves the consumers that we currently have, but also offers opportunities for individuals to meet that civic engagement that so many of our retirees and the boomers are looking for. This will be an interesting process, as we have already gotten a really great volunteer to help with the process.
Partnerships are critical to carrying out NEI3A's mission. We interface with partners across all programs and in different ways. Colleges and universities provide opportunities for us to share our work with a new generation of workers, and they provide valuable program analysis and assessment to help us plan services. Organizations such as Alzheimer's, Easter Seals, Iowa Compass, the Brain Injury Alliance, and Senior Companion Program help with referral, provide information specific to individuals' needs. Councils on Aging, community roundtables, transit advisory groups, community senior boards provide valuable referral links and awareness of community services. Churches and first responders are often the first to identify at-risk individuals to refer to NEI3A programs. Churches provide valuable community meals and support that helps serve our mission. Libraries, community centers, and the faith community provide venue space for us to conduct programs and hold meetings. Various housing trust funds, community foundations, United Ways, and other local granting organizations supplement our work and provide the required local match needed to receive the core OAA funding. We work with businesses and business groups to improve awareness at the community level. And groups such as the Cosby Center, Veterans Freedom Center, and the Eastside Ministerial Alliance provides opportunities to reach communities of need in ways that we would otherwise be unable to serve. Currently, NEI 3A staff attend at least 60 community meetings, advisory groups, provider groups, boards, and other related meetings. We want to expand on this success. This year, we will seek to nurture our current partnerships and evaluate new partnership opportunities. We will develop a full list of all partnerships and their relationship to NEI 3A. For example, if they're a contracted partner or a referral partner or a university where we offer internships and they assist with research, or a group that offers other services in the community that we can refer to, or groups that offer space for us to provide our own programs. We will develop policies around which partnerships we will invest our resources. And finally, we will develop an advocacy toolkit for our partners so they can help us advocate for the programs and services we provide and that many older Iowans rely on. This will be essential as the Older Americans Act is set for reauthorization at the end of this calendar year.
So as we look to redefine our congregate meal strategy using alternative models such as the Iowa Cafe and our pop-up programs, we still are looking to add or maintain congregate meal sites in each of our counties, and we know that that's probably our priority right now, because we have many counties that don't have a meal site. So that's what we'll be working on, but we are also preparing for working with the agency as a whole to do a more complete survey for the locations where our communities are currently gathering. We have found additional providers for our meals coming out of the local communities, such as the Hardin County Jail, the hospital in Grundy Center, and now a caterer in New Vienna to serve both Worthington and Dyersville. So we are working hard on a lot of these opportunities to make sure that the congregate meal program continues to be exactly what we want it to be.
Our initiative around Older Americans Act programming is an initiative that I believe will just simply become regular in our strategic initiatives. It really does ensure that we are focusing on those mandated programs with an effort to avoid waiting lists whenever possible. This is a function of our fairly level funding and knowing that costs have risen and will likely continue to do that. Looking at collaborating with partners in our communities when we have programming that really doesn't meet the mandated programming in the Older Americans Act, or finding sustainable funding streams that can support those programs. I think that one of the things that really becomes a discipline for us is whenever there are staffing patterns that are changing, different programs that maybe have changed, that we always step back and make sure that we have structured the support from a staffing perspective appropriately. And we know that with the realignment at the state level, there'll be more opportunities to look at how we collaborate with our partners on the disability side, and that will likely give us some opportunities to think about programming and to think about staffing patterns in a different way.
As we look at the evidence-based programming and the strategic plan surrounding that, we have made some progress, including preparing community or establishing a staff person to focus on this, and it's Elise Bovey has been hired as our team lead for our evidence-based programming. We've also continued to advance the number of classes that we offer by training for Healthy Steps for Older Adults, which we'll be begin using after July 1. We are continuing to look at each county and the number of classes that we offer in those counties. So this is a project in progress.
Moving on to technology, our strategic planning goal is to develop a marketing outreach process. We want to streamline our internal process of gathering information for public awareness of NEI 3A's services and programming. We recognize Vicki does a lot for us as far as managing our website, social media accounts including Facebook posts, creating flyers, postcards, notices, press releases, correspondences, and so much more, you just name it. All of us rely on her for advertising our important programs and services we offer. We are working on accomplishing some action steps to best support Vicki and streamline our efforts to market our agency events and services. We are developing a process for what needs to be included on our website events calendar. We are creating a form to notify Vicki of the pertinent details when you are a facilitator, leader, or assisting with or planning an event. We want to ensure we are including on our event calendar all the education the nutrition specialists provide, all evidence-based programs, dementia friend sessions, support group sessions, caregiver wellness days, health fairs, anything available to the public and consumers we serve. Along with this, we want to make the events calendar easier to read and view. Vicki has taken the lead on our website refresh project. Some of you have provided feedback on the layout and information for the website, including the events page. More to come soon on this exciting website refresh. Another piece of developing this marketing request form is to provide Vicki with the necessary what, how, when to market programs and services beyond our website. This will provide information for consistent event advertising. Is the event needing a press release? And if so, where? Is a flyer needed? What details need to be included? And so forth. This should improve communication and keep information consistent and accurate and leave less room for missing information and unintentionally forgetting tasks. One other piece of this goal is focusing on using marketing to gain donations and sponsorships to promote events. Lisa currently has a committee in progress, including work on making our website more donation friendly. The committee is also looking into developing and marketing a sponsorship program. We continue to make progress on this 2024 goal to streamline our marketing and outreach process and communicate the best we can internally that will flow to the consumers and communities we do great work for.
One of the largest initiatives we have in 2024 that we know will roll into 2025 really centers in on the realignment at the state level and reorganizing, really expanding the ADRC network beyond just the AAAs. Much of that has kind of been paused as we wait for not only the legislation to be debated and approved, but also then now pending to see exactly what the RFP that will be issued by the Aging and Disabilities Services Division, what that will call for in that space. I think it's safe to say to all of you that we will continue to do what we do and what we do best, and that is the aging network and serving the aging population in our PSA. There will be opportunities, I believe, to extend a lot of our INR and our INA kind of activities into the disability arena. Doesn't mean we're going to provide disability services, but it's going to make us more aware of what's out there, and that's really part of what that ADRC kind of refresh will provide in the state. So the update here is that there'll be more to come, and that as we learn of these we'll certainly be bringing you into those conversations and making you aware of them. But there's been a lot of talk, a lot of information flowing around, none of which really had any footing because the legislation hadn't even been approved. So whatever you've heard, forget it. There'll be lots of opportunities in the coming months to talk about what that legislation really means, what the RFP will look like for expansion of the ADRCs, and what that means for the disability populations in our PSA. So as we wrap up this strategic planning update for 2024, just want to thank you again, encourage you to dig in when you have the opportunity to dig in, be a part of a work group. We have lots of work to do as we prepare for the next plan. Always our committee, steering committee members are available for any questions that you have. Please send them to them, grab them, and and talk to them and share the questions that you may have or insight that you see, things that you think should be part of the strategic plan, because there'll be lots of opportunities as we engage all of our critical partners and all of you in that refresh of that strategic plan. But as I say, we've got a year to deliver on, so stay the course, stay engaged. And as always, we thank you for all of the great work that you do. There are the plan documents can be found within the link that's included in this newsletter update. So I hope you'll take some time to review those and really take some stock in what we have accomplished, because we couldn't have done it without all of you. So with that, thank you very much.